Hello. Welcome to a brand new community health nursing lesson. My name is Jessie Wheatley and I'll be facilitating this lesson. Please make sure you have your notes in your notebook ready so you can follow along with this lesson. Thank you for listening to this lesson. This lesson covers the U.S. public health care and public health care systems overview. By the end of this lesson, you should be able to describe the events and trends that influence the status of healthcare systems. You should be able to discuss the key aspects of the private healthcare system. You should be able to define the public health care and explain the roles nurses play in this care. And you should be able to compare and contrast the current public health care system in the United States and the responsibilities of the federal, state, and local public health systems. You need to be able to examine nursing roles in selected government agencies. Forces stimulating change in the demand for healthcare in the United States was triggered by demographic, social, economic, political, and technological um, trends. More than 47 million people in the United States were uninsured and were lacking access to adequate health care, and that triggered some of the changes. There are disparities. Disparities are racial or ethnic differences in the quality of health care that are not based on access or clinical needs or preferences or the appropriateness of the intervention. The electronic health record is an example of a technological trend that has uh, changed interprofessional care, especially for chronic disease management and coordination of care, referrals. Also, it allows for 24-hour availability of medical records. You can also allows up-to-date downloads and up-to-date assessments. It also provides reminders for prevention and for screening and for management of chronic disease. And it has really improved quality in measurement monitoring and has helped with patient safety. Technological advances have also helped with the reduction of medical errors. The state Children's Health Insurance Program uses the health information technology and builds on Medicaid to provide insurance coverage to low income uninsured children who are ineligible for Medicaid. Um, in summary, current healthcare system in the U.S. is influenced by the cost of healthcare, access issues, how well people can access services, and the quality of healthcare. Let's define a few terms. Healthcare in the United States is made up of a personal or private care system and a public health system. And this course is more about the public health system. With really, it's an overlap between the two systems. That's how you would define it to somebody. Let's talk about a few things about it. Primary care is a personal healthcare system that provides for first contact, continuous, comprehensive, and coordinated care. Primary care is part of primary health care. What is primary health care? Primary health care is essential care made universally accessible to individuals and families in a community. Healthcare is made available to them through their full participation and is provided at a cost that the community and country can afford. Okay? Public health care is different from primary health care. It refers to the organized community efforts designed to prevent disease and promote health. So the U.S. health system is an overlap between primary health care or personal care and public health care. Let's talk about one more term. Managed care is a system in which care is delivered by a specific network of providers. Each provider serves as a gatekeeper who controls access to other providers and services. Cost is usually reduced because members cannot use specialists or seek hospital or other um, care without permission from their primary care providers. So, those enrolled in Medicaid or Medicaid managed care have restrictions that help keep the cost down for the government, and that's also the cost down for the taxpayers. Medicare's provides Parts A, B, and C. Medicare C is the Medicare Advantage program, which has got HMOs and PPOs, and then Part D is the Medicare prescription coverage. Okay. Some of the forces influencing healthcare in the United States, there is an increase in the focus on emergency preparedness and response since the tragedy of September 11. We know healthcare reform has made big impact. I want to share the American Nurses Association's position is based on the belief that healthcare is a basic human right. Um, Nurses are most often able to fill the gap between personal care and public health care because they have skills in assessment, in health promotion, in disease and injury prevention, in knowledge of community resources, and ability to develop relationships in community members and leaders. So, nurses are a big force in influencing healthcare in the future. Thank you for listening to this lesson. I hope you have enjoyed this very quick overview of U.S. public health care and public health care systems. And the notes have a little bit further detail. If you have any questions, please feel free to email me. Have a lovely day.